from Tangmere Dental Care near Chichester. Today I'll be doing an evaluation in terms of the logistics of the DentalAir LEV and the VacStation LEV to try and control aerosol at the point of production, sort of in front of the patient's face. So I'm going to be looking at the size of the units, being able to position it by the dental chair, how easy it is to get the actual arms into position so that they're stable in a position where maybe they'll actually do the job that they're supposed to be doing. Other things like the control panels, how easy they are to move around. I've got my watch on, which I will set to the decibel meter so we can see how loud each of the units are. Right, so on to the first of the tests. I mean, when I first saw these units, I thought that they were possibly in the same box because they look so similar, but as you can see, they're not. So they are actually, within really 1 or 2 centimeters of each other in terms of the actual box size. So the next thing that I want to do is the practicality in terms of reach. Now, I set them up like this because it's then quite easy to see. One of the advantages of the DentalAir, apart from the fact that it has got slightly better suction, we've got a definite reach advantage. So it's going to be possible to place the DentalAir further down the chair away from the field of working. And then of course you can curl this around like so. And also this section here is telescopic, you could bring that up. And I have actually spoken to the manufacturers about sort of some of the issues with this, in the sense that even that reach isn't sufficient to get the aeroshield over a patient's face from the foot of a chair. They are actually going to be producing some sort of an extension tube on here, which is rigid, so that we could get that all the way from the base of the chair right the way up over the top of the patient. So that, in that respect, once that upgrade option is available, that'll make it usable from the foot and then all the way around the circumference of the chair. So I've covered reach, and as we can see, the reach there, and this is quite stable at this length, so at this maximum length. Obviously when the extension arm is in here, I think that's going to add an extra ½ meter, which as I said, should take it to the top of most chairs. On the VacStation, I did have an issue when I was trying to do the vape smoke test. In terms of this length, I have actually set this to pretty much the furthest it can go. So you're going to have this base unit within 80 centimetres, centre of that unit there, 80 to 90 centimetres, within a metre of the operating field. Now, you can see the problem is a little bit too far. Needs a bit of grease, doesn't it? It's a little bit too far, and this doesn't hold. So this really limits the placement of the unit in the surgery. Now, okay, so obviously that's the size and the positioning of the arms, and how flexible is it in terms of positioning. And as I said, I will show you in a moment. One other small point that I've noticed here is that the DentalAir is totally on wheels. The VacStation has got wheels on one end, this end here, so if you want to wheel it, you've got to lift that up. The other end, they're a little rubber feet, so you can't, I suppose that stops it moving around, but in terms of actually wheeling it from place to place, that said, these are very unwieldy and not that easy to move. Okay, so on to the next part then. Which is actually the controls themselves, and I'll be doing a noise test measurement here on each unit in turn. So with the DentalAir, I'll do that one because it's closest. We've got the remote control. Right, so we've got a power button, we've got higher fan speed and lower fan speed. We've got a timer, which here, that would actually be useful in relation to leaving the unit on if you had some fallow time that say you wanted 30 minutes or 40 minutes fallow time, you could set a timer here. Got a lock button, so if you press that, that disables the panel on the side of the actual unit. So I don't know if you'd have kids running around. I mean, that's going to seems a long way off before we'll get back to that. I do like this, very cleansable, very white clean. So that could be covered with plastic, and of course you can just turn the unit on from a distance. Just to show you the DentalAir controls, actually on the unit itself. So the actual control panel here has the on-off button in the middle. I've turned that on. It's going to get a little bit noisy. And then these illuminators here indicate percentage. So let's turn this down. 90%, 80%, 50%. And you can take that right on down quite easily. And then higher fan speeds here. Obviously off again, time set if you want to actually have a fallow time for the surgery and then leave it running. And then of course here, what's that? That's OK setting, so something to do with the timer there. I'll pick up the camera so you can do the noise test with this. So close to the unit we're getting sort of somewhere in the region of 70, high 60s to low 70 decibels here. It is fairly echoey in this room, so that tends to amplify the noise. But as I said, this is set to 100%. I'll just crank this down, and what I'm going to do now is crank this up to 100%. Right, so airspeed velocity in the actual funnel here is around about 7 meters per second. It is actually interesting to see that the airspeed follows the inverse square law. So here, where the nozzle is quite big, we're about 6, 7, 8 meters per second. If I take this apart, pop the anemometer in there, we are now getting air speeds of around about 27, 28 meters per second. So it's quite a decent rate of suction there. Just turn that off. So now moving on to the VacStation. I'll just bring this forwards a little bit, make it a little bit easier. Just forget that it's not on wheels, so I'll lift that front edge up there, bring that a little bit closer. Right, with this unit, all we have is the control box. There is the on-off switch at the side there, which did fox me to start off with because I turned it on here and nothing happened. There is a little LED down here. And that's basically it, apart from this control box here which just says smoke absorbs control. So I'll switch that on, turn that up to maximum. So let's just do a sound test. So we're getting in the high 60s, low 70s again. Final test in here will be the anemometer again. So I'll put it right by the entrance. And yeah, we're getting around about, just going over 5 meters per second there. So in the high 4s, low 5s in terms of meters per second, and I've got it almost right in the actual hose here. The actual levels here are relatively comparable, apart from the fact that this is much harder to position. So I'm just going to do an air velocity flow check now through the actual nozzle on the VacStation. We'll pop the up there. We are actually getting to a flow rate of maybe 17 or 18 meters per second, which is pretty good. Obviously not as fast, but this is a larger diameter pipe. Okay, so the next bit then will be actually taking these units through and seeing how they fit in the various surgeries.